We can't have anything too hot, too cold, too hard, too sugary. I have a broken tooth, have an abscess, I have mouth pain. I can't smile because the air hurts my teeth. In the United States, 3.5 billion people cannot afford dental insurance in addition to their medical insurance. Yet, for profit insurance companies separate dental and medical insurance coverages. An article by the National Institute of Dental and Craniofacial Research, released on November 10th, 2023, states that untreated tooth decay cost the U.S. about $45.9 billion in 2015 and often results in visits to the hospital emergency rooms where care is often palliative but does not treat the root cause of the problems. Gum disease is a risk factor for nearly 60 other adverse health conditions such as Alzheimer's disease, diabetes, and heart disease. My goal today is to convince you that oral health should be considered a part of physical and mental health, and that insurance companies should not be allowed to profit on the suffering of billions of Americans. In today's presentation, we will examine the effects. We will review the causes and explore ways that we can solve this issue for millions of Americans today. Too many adults in America feel a type of isolation when they have poor oral health because they do not want to smile and risk humiliation. The American Psychiatric Association study released on September 19th of 2023 revealed that when a person has poor oral health, it can impact their eating, speech, and self-esteem and lead to reduced social interactions, further harming their mental well-being. Diet becomes affected, that could lead to malnutrition or obesity because they are unable to chew the foods that would provide better nutritional value to their bodies. Oral health is the state of the mouth, the teeth, the oral facial structures that enables individuals to perform essential functions such as eating, breathing, speaking, and encompasses psychosocial dimensions such as self-confidence, well-being, and the ability to socialize and work without pain, discomfort, and embarrassment. Oral health varies over the life course from early life to old age, is integral to general health, and supports individuals in participating in society and achieving their potentials, according to the World Health Organization website, last updated on August 10th of this year. If we understand that the effects of poor oral health are extensive, why is this happening? Well, we'll now look at just a few of the reasons for this epic issue. We can start with profits. An article released by the Pennsylvania Capital Star website on August 10th of 2023 highlights the exorbitant amount of profit received by healthcare companies. America's largest healthcare insurers raked in more than $41 billion in profits in 2022. If you have poor oral health, these insurance companies can easily increase their profits from people's inability to pay for dental care. Other causes for poor oral health are poor oral hygiene, genetics, eating disorders, medications, and traumatic damage, such as broken teeth. Starvation wages prevent many from accessing affordable dental care because out of pocket expenses have skyrocketed due to this pretend inflation. And I do say pretend because we cannot have record profits for all of these corporations while costs still have gone up. Let's call it what it is. And that's capitalistic extortion. In the United States, people are more likely to have poor oral health if they are low income, uninsured, and or are members of racial or ethnic minorities, if they are immigrant or rural populations who have suboptimal access to quality oral health care. As a result, Poor oral health serves as the national symbol of social inequality. And this is from the article from the National Center for Biotechnology Information. And it was written by Chengming Han on August 8th of 2019. Well, of course, we know many of the causes of poor oral health, but we need to figure out what to do about it. Vote. Vote policy over party. Yes, politics has its hand in every aspect of American life, and it is the politicians that create and regulate the laws that should benefit their constituents and not the industry. Attend political events, uh, and tell your local representatives how this affects you personally. The more people who vocalize their concerns over how their insurance company's business practices are, the more likely the representatives will be able to raise the concerns on the House Judiciary floor. At least in a fully functioning House, they would, but I digress. Educating people on the benefits of a single health payer system, taking into account both the costs of coverage expansion as well as savings that would be achieved through the MAA. We calculate that a single payer universal healthcare system is likely to lead to a 13% savings in national healthcare expenditure, equivalent to over $450 billion annually, according to the Nation Institutes of Health, released on February 15th of 2020. With the funds saved by the universal healthcare system, perhaps people can afford the teeth they need to eat. Today, we have examined the effects of oral health on our mental and physical well-being, reviewed some of the causes for poor oral health, and explored ways that we can solve this issue for Americans by contacting the local representatives. If we don't act now, Congress will continue to allow predatory insurance practices. Costs will continue to rise so that profitable insurance companies can make record high profits every year. People will continue to suffer, which will affect both employers and employees through lost productivity and lost wages. And while it's easier to let other people deal with these issues, if we don't act now, our future generations will have to bear the burden, and it's just not fair to them. I would like to be able to enjoy things that are hot or cold or crunchy or sugary. I don't want broken teeth or abscesses or mouth pain. I just want to smile again.